Hello, my name is Abdeladim Dakri. I'm a student at West Coast University, and I'm going to be presenting my paper based on an article named Vitamin D and Glycemic Control in Diabetes Mellitus Type 2 that was published in the Therapeutic Advance and Endocrinology and Metabolism paper. Why the scientists performed this study? It was done because of for the purpose that mild and moderate vitamin D insufficiency have been proposed to be a risk factor for diabetes type 2. And as scientists, they have to find a solution for this epidemic. The hypothesis of this research paper suggested that vitamin D deficiency appears to be related to the development of diabetes mellitus type 2 and the metabolic syndrome. The major technique used by the scientists in this research paper was a quantitative method with experimental design, where they gathered a lot of information, a lot of data using numbers, and they put them together, and to come up with the result they used a statistical evaluation that was used to perform and analyze the results. So the major result that they came up with is they found that the 25-OHD3 levels were inversely associated with HbA1c levels, and which supported the hypothesis that in fact the vitamin D is deficiency is a risk factor for the diabetes type 2. Why did I choose this particular article is mainly for a personal and family reason. I am a diabetic type 2 myself, and recently I have been diagnosed with vitamin D deficiency by my doctor that recommended for me to take supplement vitamin D because it is not helping me control my diabetes. So for health issues and for personal reason, I did choose this article because I do believe that there are millions of people in the world with diabetes type 2 suffering from this chronic disease, and that controlling their vitamin D plays a major role in controlling their diabetes. In the synopsis of the paper, the introduction that we conducted was that the lack of vitamin D intake appears to impact the development of type 2 diabetes mellitus. The authors hypothesized that people who have type 2 diabetes mellitus have vitamin D deficiency, and that patients may control the glucose level with the intake of vitamin D. In the method that was used, the researchers used quantitative method with experimental design, and where they measured the levels of 25-hydroxy vitamin D3, 25-OHD3, and glycosylated hemoglobin HbA1c of 120 patients with diabetes mellitus type 2 and a control of 120 subjects having the same age and gender in the area of Athens, Pico in Greece. A second step produced by Employed, in which 25-OHD3 was measured by radioimmunoassay RIA, a technique that measures small amounts of antigens in both groups. The first step emailed an extraction of 25-OHD, and the second step involved by assaying by RIA. The samples was incubated for 90 minutes at about 20-25 degrees Celsius prior to centrifugation. High-performance liquid chromatography was used to measure glycosylated hemoglobin HbA1c, which was chromatographically separated through ion exchange liquid method, in which the hemoglobin separated based on the ion interaction. A statistical evaluation was performed to analyze the relationship between 25-OHD3, and HbA1c, and a chi-square test documented the number of patients with vitamin D deficiency and insufficiency. The results of these methods, the groups of diabetes mellitus type 2 patients showed higher level of HbA1c than the controls. The HbA1c levels in the diabetes type 2 patients were at 7.2, 0.18%, as compared to the control group showing 5.1 plus or minus 0.05% HbA1c. 17.5% or 21 of 120 patients with diabetes type 2 showed vitamin D deficiency 25-OHD3 levels less or equal to 10 ng per ml, chi-square test where p small p equals 0.0089, as compared to 5.8% or 7 of 120 of the control group. Vitamin D insufficiency 25-OHD level D3 levels under 20 ng ml, chi-square test small p under 0.0001 was detected in 76 patients with diabetes mellitus type 2, or 63.3%, which is contrasted to 28 or 23% in the control group. There was also a significant difference with regards to 25-OHD3 levels, HbA1c levels, where p is under 0.001 and r squared equals 0.086 in patients with diabetes mellitus type 2 and control. In our discussion, the authors observed that the diabetes type 2 groups have lower 25-OHD3 levels than the control group, and concluded that 25-OHD3 may impact glycemic controls in type 2 diabetic mellitus patients, and that vitamin D control glucose because patients with diabetes mellitus type 2 have higher vitamin D deficiency and insufficiencies. The author also observed that vitamin D, which is produced when the skin is exposed to the sun, is a serotonin and beneficial for bone metabolism. It boosts the immune system, and that the development of autoimmune disease, including multiple sclerosis, rheumatoid arthritis, and type 1 diabetes, are related to vitamin D deficiency. The study suggests therapeutic implications for patients with type 2 diabetes mellitus to take vitamin D supplements, as vitamin D may help control glucose levels. In our discussion, the strength and limitations of this article, one of the strengths was that the study was not funded by any particular research grant or public or commercial or any nonprofit or any for-profit agency. There is an advantage to not being funded in this manner because it gives the researchers some independence when conducting the study, and results do not depend on funding. Further, subjectively in the study was minimized because the data extraction was based on a cohort of 120 diabetes type 2 patients who were already on treatment with anti-diabetic drug and control group. And the control group. As the research has not been funded for any specific grant or funding agency, the authors themselves recognized the limitation of the study. They stated that the study was merely an observational study of a population of 120 diabetes type 2 patients and a control group in the area of Athens and Piraeus, Greece. They could not definitely conclude the cause of effect relationship between vitamin D deficiency and diabetes mellitus type 2. The authors commented that more data will provide a more comprehensive understanding of vitamin D deficiency in diabetic patients, and suggested additional studies to use finer tools in the relationship of vitamin D supplementation and glucose control in diabetes mellitus type 2. This article, in the public health implication of the article, although the researchers recommended that additional data and studies should be performed for more definitive conclusions, the results of the study are promising is that the use of vitamin D in diabetes type 2 patients to control glucose levels seem to protect against the disease. The observational studies provided convincing data despite its limitations. There is some evidence to suggest that findings in these articles are supported by other similar studies on the relationship between the intake of vitamin D and glucose level. The public health implication is that diabetes type 2 patients may stop taking their medication and enjoy days of sunshine to absorb vitamin D and eventually get rid of their bodies of the disease. If the study results are accurate, the disease could potentially be wiped out and the pharmaceutical conglomerates controlling diabetes mellitus type 2 medication will suffer a financial blow. Thank you very much for watching my video. I wish you a great day.